How is everybody?
Wonderful.
Well,
Thank
All
you.
right, I'd like to call this Health and Human Services Committee meeting to order. February 20th, 2024, it's 3:46 p.m. We'd like to start with Social Services and Commissioner Gibson.
Relatively brief today. I was on point one meeting this morning. Just my requests and all of my resolutions have to do with positions today. So I have two caseworker positions to fill presently. I'd like a request to fill those and any backfills created therefrom.
Move it. Second.
Further discussion? All in favor?
I have a
Opposed?
question.
Sure.
Why are they resigning?
So one got a promotion
Oh, okay.
and one reworked something out.
Okay. All right. There you go.
Not just like a promotion.
There you go. It says-
Enough said.
Yeah, there you go. Thank you. Okay.
Okay, also a request to fill one social welfare examiner position, grade 12A, and any backfills created therefrom. Also,
Or something else.
also, no, better than that, also as a result of a promotion.
Okay, I'll move that one. Okay. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And a request to fill one senior social welfare examiner position, as a result of someone getting a better offer from the state.
Move it. Second.
Further discussion? All in favor? Opposed?
Very quickly, since I didn't have a whole lot going on, I did send down an article today, and it's okay if you didn't get a chance to read that yet. If you do, please, there's a national network for the care portal that's been going on that got started up in our community in the last 18 months or so, and it's had a profound effect on us getting services out to the public that might have cost the county a great deal of money, and or not been available, but for a discretionary fund that I have. It's an incredible movement. Take a look at the article. It's all volunteer. It's all, it's faith-based in as much as that's who ends up putting the resources together for the portal, but the recipients never know from where they got the benefit from. And it is rather vast nationwide. And I'm going to close out our fiscal year 23 budget. And we've been looking at it, and the local share in our budget has gone down. And it's pretty nice. And in a $38 million budget, when it goes down a few percentage points, that's not just a couple of bucks. So I just wanted to sort of give a shout out to it. And if you'll note somewhere in the body of the article itself, it starts out with wanting to help children in foster care, and it certainly does that. Then it moves on to prevention work so that children don't get into foster care. But you can see around the country, they've started to use these care portals for reentry, people coming home. There's once you get a vibrant network going, good old fashioned philanthropy takes hold and where it ought to, which is in the community with people with resources. So I just wanted to bring that to your attention. There's a really good movement afoot. It'll tie a little bit into what Director Almasi's going to get into a little bit later, but it's working really well in our community. So,
Do you think that contributes to our lower foster care numbers? Because our care numbers are down significantly year over year for January.
I won't say no, but a lot of that has been our vast increase in prevention services.
I mean, those are the most positive numbers you have.
Very, very positive.
Yeah.
Very. In fact, we work with the state to see when we'll probably see water reach its level on that, because of course I want to see a zero, and the state tells me that is just not very likely, but to see numbers as low as they are.
Of those in foster care, you're saying?
Yeah.
38 right
Yes,
Well,
yeah.
compared to 56 or 8
Oh,
last
compared
year.
to 253
Yeah.
when we came aboard 10 years ago.
Yeah.
What I will tell you is, yes, I think the care portal helps us with our prevention work. and it buys things like cribs and beds, and it gets parents to work, and it puts tires on cars, all the things you might not see. So yes is the answer to that.
Good work.
Looks great.
And
Great job.
the rooms, the number of rooms for homeless right now,
Holding
Yeah.
stead,
holding stuff.
holding stead. Okay. Warming center is coming. As soon as I can make an official announcement, I will,
Before it has to go into a cooling.
Right.
which I'm okay.
Okay with that too.
Okay with that too. Thanks.
Thank you, sir. All right, Director McGann.
Hello, everybody. A couple of things here today. First is a request, to accept climate and health adaptation grant funding.
Second. All right.
I got a question as to what you're doing with it.
So you already know what it is.
Yeah, sure. We're, getting a small, award of $3,000 from NICEHO, the New York State Association of County Health Officials. And we're planning on using that for tick education and to create and distribute tick removal kits, which the state stops funding us with.
Just didn't know where you're going with it.
Tick time's coming.
Tick time.
It's already here.
Yeah.
Like old school.
Yo,
Yeah.
really, come on.
Last one was that warm that.
So we have a move in a second, right?
Any further discussion on this? All in favor?
Aye.
Opposed? Carried.
Authorization to amend resolution 360-2023 because the XRF analyzer had increased in price.
Oh, God.
That is the lead, detection
I'll
machine.
move that.
Yeah.
Second,
Further discussion? All in favor?
Aye.
Opposed? Carried.
Everything else you need, we have to use those other prices, because then you gotta have.
Go down.
Request to contract with Atlas Search Health Solutions LLC for early intervention and preschool services.
Yes, I'll move that.
Second. Further discussion? All in favor? Aye. Opposed? Carried.
And authorization to carry over funding from 2023 to 2024 on several of our grants.
Move it. Second.
Further discussion? All in favor?
aye.
Opposed? Carried.
Authorization to contract with the Columbia County Healthcare Consortium for implementation of the 22-24 Community Health Improvement Plan.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
There's a great article in the Times yesterday about how many of us could pass the presidential fitness training. Remember that we had when we were all in elementary school? Apparently nobody. Passed it anymore.
Biden's taken the ballet for 46 years, he said.
Really?
I don't know, he can fit it out of me.
I think possibly my avatar could pass the fitness challenge.
Go
Do you
for it.
remember that movie Wall-E?
Yes.
Yeah.
How prophetic that was, and everyone has their own avatars that are playing tennis against each other while their bone structures all get. It's a great movie. I digress. I'm sorry.
I agree with you. I concur with that.
A request for authorization to contract with an agency to provide psychological educational evaluation for preschoolers.
Move it. Second. Further discussion? All in favor? Opposed? Carried.
And a request for the Columbia County Board of Supervisors to pass a resolution in opposition of Governor Hochul's proposal to cut rabies funding for counties in the 24-25 executive budget.
Move it.
Second.
Second.
Further discussion? Or at least they could give it to us in Lyme's prevention.
Right, yeah.
So this is post-exposure treatment and offering free rabies vaccination clinics.
So, yes, this includes the vaccination clinics for animals that we do for a year because that is the absolute minimum that is written in the public health law. And that also covers un- and underinsured individuals who require the post-exposure series.
So the way I understand this is we're gonna have to provide these services anyway, so it's gonna be county dollars.
Exactly.
We get $20,000 every year. We always go over it. But of course, we count on that $20,000 to get us there.
Of course, yeah.
And all of the things that we do in the rabies program are written in state law.
So it'd be an unfunded mandate. basically.
Right, exactly what the budget.
Especially if we want to branch out into livestock treatment. I'm kidding. But I'm telling you, if someone needs to raise large animals, you couldn't do that yourself. You had to get a vet to come and do that.
Certainly.
Did we have a motion?
We had a motion and a second.
Okay.
Discussion is wrapping up. All in favor? Aye. Opposed? Carried.
Request authorization to renew contracts listed in appendices A, B, C, and D for early intervention and preschool.
I'll move that.
Second.
Further discussion? All in favor? Aye. Opposed? Carried.
Request to authorize the Director of Children with Special Needs to bid, award, execute, and adjust transportation contracts.
I'll move it.
Second.
Further discussion?
Just a question. So if if these children need services and are authorized for services, do we cover the transportation for their services?
Yes.
And these are the contracts to cover that transportation?
Yes.
Okay,
In the preschool program, we have the financer and the transportation coordinator.
both, okay. And about how many kids do we have?
In preschool, I have that in,
in the?
The
It's okay,
report,
we're
we
gonna
list
get to
it
that
every
later.
month.
Okay, I just didn't see it, okay.
The chairman has to
100.
sign all those contracts.
Yeah.
There's a lot of them.
Thank you. 126 students in the preschool program this month.
Okay,
And that fluctuates, but not tremendously.
that's a lot.
Yeah, a lot of, yeah,
Yeah,
it
yeah.
is.
All in favor?
Aye.
Opposed? Carried.
And I've got a couple conference forums. We're sending our public health educator to the National Forum on Overdose Fatality Review. And
I'll move that.
that is funded by Nice St. Joe.
Second.
Further discussion? I had a question. I know this comes from left field a little bit, but in the breakout sessions of this seminar, it's talking about including hold on one second. Including suicide as a number for an overdose fatality rate. Do you think that will significantly increase those numbers if you attribute suicides to the overdose data point?
Yeah. Yeah,
I think so. Yeah. We do.
why would they do that? See, overdoses.
I mean, it's, yeah,
But but it isn't an overdose one of the easier ways. If it's suicide?
But you don't know if that's what the reason, you know.
Yeah, well,
It's-
unless they
it's-
leave a note or.
there may be others in the room who might speak to this a little bit.
Well, the only question that comes to mind is, what was the rationale? Because to Supervisor Eldridge's point, their accidental overdoses where one ingests a drug with no intent of committing suicide. Then there are instances where one ingests the drug with the purpose of committing suicide. And to suss that out, unless there's evidence of a suicide, such as a note, is very hard to do. So I don't know what would prompt the call to mesh the two numbers.
And they're spoken about in similar ways as death of despair, in some public health, kind of conversations, but, you know. I
Who
don't know
would
if
rule
that's-
it a suicide? Would the coroner rule it a suicide? Who officially determines whether it's a suicide or an overdose? An overdose, a suicide by overdose. I mean, that seems to me where the difference in the numbers is, and it seems to me that that's almost incalculable. To your point,
Yeah,
how would you possibly calculate that?
exactly.
So that's
Public safety,
a big question.
You know, we were.
But it's all speculation on a breakout session in a
is.
seminar.
Yeah.
Not-
That we haven't
So we
gone
look
to yet.
forward to Mrs. Black coming
Yeah.
back with
Yes.
that information.
Certainly.
Taking us on another tangent. All in favor? Aye. Opposed? Carried.
We're just in favor of the conference, right? Not-
Yes. Right, yeah.
Yeah,
Just to be clear.
Yeah.
we don't have to tell them to strike that from the docket. It's,
No.
And then, this is a conference, for immunization coordinator, the National Conference for Immunization Coalitions and Partnerships.
I'll have to move that.
Second.
further discussion? All in favor?
Aye.
Opposed? Carried.
All right, I think we're in my report. So unfortunately, we did have several respiratory illness deaths this in January. We had 2 deaths RSV, 15 cases of RSV in long-term care facilities. That is reportable, so we are has been made reportable, this past October, so we are monitoring that more closely than we ever were able to. We had several COVID and flu outbreaks at long-term care facilities. And then one correctional facility had a small outbreak as well. We had 256 positive confirmed cases of COVID in January, and then we created a little an image that compares each month, starting from 22, 23, 24. If you scroll down slightly, sorry.
I'm just trying to unlock the front door. Sorry.
Yeah. So that small dot there over January indicates what we've experienced this past year, and then the top line, color coded on mine, sorry.
They don't send it to me.
Yeah,
If
sorry.
they send it to me, it'll.
The top line represents 2022, and the bottom line, or the middle line, is 2023, and then that small dot there at the very bottom is 2024. So we are significantly lower than.
We're up a little from December, but down from last year.
Yes.
Thank you.
So we did have two deaths from COVID in January. They were community deaths, both people in their 70s. I think one of them was up to date on their vaccines. That is not typical for the deaths that we see. We typically see them in people that are far behind on their boosters. This person did have several other comorbidities, unfortunately. And then our wastewater data for the city of Hudson had a bit of a spike there, but has already since come down.
It's just like during Christmas.
I was,
Yeah.
I joke that could just represent our office around that time, I think, because there was a period of time there where it was just everywhere. So okay, so we've got 47 Lyme cases in January. That's kind of a lot for a month that's supposed to be the dead of winter.
Yeah.
Yeah.
It wasn't cold enough to.
Right. And then we had 0 rabies submissions, and then 1 series of post-exposure. Environmental completed 34 inspections at various tobacco, food service, migrant housing worker housing, 9 healthy neighborhoods visits, and then 2 sewage disposal applications. That's 156 vaccines from 102 patients. The provider shortage continues in the preschool and early intervention program. Our director is retiring at the end of this month. We have a replacement coming in towards the end of March. And then the EI Hub, which is the database, has started to release. There's an in-person training on February 29th so that everyone can get up to speed. So hopefully that is as good as it needs to be to keep us moving. The special needs registry and LICSA plans have been updated. The mass casualty plan was updated in conjunction with the Office of Emergency Management and the county coroner. We have explored the idea of creating a medical reserve corps in Columbia County. That's a federally recognized program. Different from our system that we used through the pandemic and up to date, because it's it's really the training that really makes the difference between those two groups. We would still use the Serve New York program because that automatically does all of the background checks. That would be very cumbersome if we try to find another way. So there's really no reason not to use that. But the Medical Reserve Corps would require a lot more of engagement and training with the volunteers who do sign up with us. So we're working on that. And I'll keep up to date as that develops. Public health education, we did create and put a new respiratory illness tracker on our website that tracks COVID, RSV, and flu for this season. That is in our data mapping. If you go to our website and toggle from the top, it's in our data mapping from our menu. That's coupled with our overdose dashboard. Then LICSA, 0 referrals, no maternal child health, 0 discharges. And then 47 open and care coordination for lead.
Oh, thank you.
And I will give a plug to your EOH app, which reminded me, was it yesterday, that you should avoid raw cheddar because of E. coli.
Mhm.
Very nice work.
Thanks very much.
We have a question from Supervisor Cousin.
Hi, we were scrolling kind of fast, so I was just curious, did the job for the special ed coordinator get posted? I had a couple of people that were interested in that job, but I didn't see it posted on the website anywhere.
Yes, so the Director of Children with Special Needs was posted on Indeed, on our social media, and then I believe I emailed it to everyone who requested that posting.
Okay, I never received it, but I'll double check my email. Thank you.
Okay.
All right, any more questions for Director McGann? Thank you very much.
Thank you.
Sir?
Yeah,
I didn't
yeah.
know where Dan's stuck.
Daniel, yeah. Thank you. I panic when I don't have.
You didn't get that?
Yeah, that's your thing.
Okay, I've got a few resolutions. One is to request a rollover for the cost of a new vehicle from 23 to 2024 as per resolution so-and-so dated back in November. What's happened is, we have an organization that's willing to give us $40,000 towards the purchase of another transportation vehicle. And that was the same time last year when they changed the way of bidding on cars. So we figured, well, we'll wait till after the first of the year and do it. And then not realizing that we couldn't do it until we had to redo a resolution as per the controller to carry it over to this year. So,
What kind of vehicle is it?
well, what we want to get is some kind of a transit vehicle that'll hold up to 7 people.
Although there was a vehicle that was identified, I thought from your department, it could possibly be an EV in the future. Jim gave us an email on the other day.
Yeah. I was wondering if it was this vehicle.
No,
Right, okay,
this is something for transportation.
Yeah, that was.
okay.
7 people makes the mileage go down.
Yeah.
I had a first. Do I have a second?
Second.
Okay, further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, my next resolution is a request to carry over unused COVID-19 funds from last year to this year.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And another resolution to carry over the unused funds from the Everhome pilot program from last year to this year.
I'll move it.
Second.
Further discussion? Looks like you spent some though, since
Oh, yeah,
the last time.
we
Down to
used it on-
121.
It's used on the person that we hired to work with us. We've used it on some of the meals that became their clients. You know, instead of us paying for it, they paid for it. And we've used it for home care aid too services. If they required our home care aids, then they paid for that. So
Right.
we got some of the money back.
There you go.
All right. All in favor?
Okay.
Opposed? Carried.
Okay, and the last one is to request permission to enter into an agreement with an organization called Blooming Health Incorporated. It'll provide an automated system to communicate with our clients. It's free of charge. The State Association on Aging is paying for this for any county that wants to
Kind of like
join.
New York Alert only for seniors, is that one?
Yeah, it's kind of like that. It will look like if we have to close down because of health reasons or poor weather, so forth.
Is it text or call? or
It's
anything?
whatever way they want it. They'll do it either. Each person's gonna be personalized, whether, you know, as you know, not all seniors are adept to getting, computer emails and stuff like that. So whatever way they want us to communicate with them, they'll communicate.
And then how do we reach out to the seniors?
Pardon me?
How do we identify
Let
the
them know the
seniors?
program is there.
Right,
You start with a phone. You give them
And
the
again,
number.
this is just for our clients, okay? It's not
Oh,
for
just
all,
your
it's
clients,
just for our
okay.
clients. Like,
Okay.
if, example, like up in your area, if you
Someone's
get bad snow up there, it will just alert the Canaan people that meals will be canceled that day and not, you know, it'll save our staff an awful lot of work for us. So, And it should eliminate the, oops, I forgot to call this person.
Yeah.
And so forth. So, and it's free of charge. The state association's paying for it. I know it's a carrot at the end of the stick, but, I was just told before I come over that they were supposed to pay through September of this year. And I was just told they've extended it to September of next year. So it's a free service to county.
Agree, I'll move it.
Further discussion?
Second.
All in favor?
Aye.
Opposed? Carried.
Basically all I have. If anybody has any questions?
We have you for one more meeting?
Yes, one more meeting.
I figured so, with him saying.
I timed it that way. So.
Thank you, sir. Huh? All right, Director Almasi.
Afternoon, everybody. 9 resolutions today. I'll try to make them
That's it?
quick and brief. Start as we usually do with financial resolutions. The first one that you see in front of you is just a resolution requesting acceptance of money from the Office of Alcohols and Substance Abuse Services. Thank you.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Second financial resolution is to cover shortfalls in the budget. Some of our silos came up a bit short. We just want to move money around to balance things out.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed?
Okay, first of 3 personnel resolutions. First one is to abolish the Senior Psychiatric Social Worker Assistant 2 position. This is pretty much an obsolete title within civil service. So the individual in this title is retiring, and we'd like to, create and fill a Senior Psychiatric Social Worker. So I ask for your support in doing so.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Similar to the first resolution there, we want to abolish the PSW position and backfill it with a behavioral health care coordinator position. There will be significant savings here of just under $20,000. We'll be doing so.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And the last resolution has to do with filling a vacant supervising behavioral health social worker. This is one of our clinical supervisors that's opted to retire. So we'd like to just backfill that.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Onto general resolutions. This first one is to contract with the outgoing Senior Psychiatric Social Worker Assistant 2. That gentleman's name is John Lyons. We feel it would be beneficial to contract with him for a period of time, no longer than 6 months, no greater than 6 months, to assist the incoming individual in transitioning. It's a pretty big lift. So to have that individual available to the incoming candidate would be ideal.
I'll move that. We need
Second.
good training.
Further discussion? Well, we have to, Mr. Lyons, our thanks. He was with us
Yeah.
for some time, I believe.
Yes, I believe it was 30, I forget how many, but it's over 30 years. The other employee was 34 years, who's retiring. So we're
Wow.
using a lot of institutional knowledge and talent.
Yeah. We need that.
Thank you for your support on that.
We get an all in favor?
Aye.
Opposed? Carried.
General resolution number 2 is to continue a contract with People USA. They provide us the certified peer specialist that is embedded in the clinic. That's the individual with lived experience that works with our people as they come in through the admissions process. They also do outreach to individuals that are on the psychiatric unit who are referred to the outpatient mental health center to ensure that there's a warm handoff and improves the likelihood of that person showing up at our doorstep once they've been discharged from the hospital.
Move it.
Second.
Further discussion? All in favor? Opposed? Carried.
second general resolution is with the Mental Health Association for the very same thing. Trying to just see which one of these nonprofits can provide me with the best candidate, and I'll go with whichever one provides me that candidate.
I'll move that.
Further discussion? All in
No.
favor?
Who's that?
Aye.
Opposed? Ron had the
Okay,
second.
thanks. I missed it.
Carried.
And then the last general resolution has to do with, in speaking with Julianne Bauman of the Reach Center, which is under the Mental Health Association of Columbia and Greene Counties, she's made me aware that initially they lost some funding for a human trafficking program. I believe it was a grant. However, that money partially came back to them. In an attempt to make that program whole, I've offered to her that I would offer federal salaries to share dollars in the amount of $30,000 to do that. What she has told me she intends to do with that is to provide education and programming to not so much the victims in this case, but for lack of a better word, the victimizers, the individuals who solicit individuals being trafficked. In this case, I'm talking about sexual trafficking, to help whether it's, boys and young men learn about different ways to approach women, to think about relationships, to think about intimacy, and also those that have had experiences and maybe been arrested for such offenses. So the program is going to be taking a turn in that direction with this funding, and I think it would have a very profound impact. If you take away the customer, let's just say, there may be less of a desire for these victims. And that's a very oversimplified way of looking at it.
It's also a very tall order.
In what regard? Yes, it is, absolutely.
Ambitious, I'm not saying it's a bad thing, I'm just saying it's a whole, it's a departure from traditional.
They do a lot of, the Reach Center does a lot of work already in schools with young people and the girls, and to make them aware about their bodies and how to value them and what to look out for and things like that. So this would be approaching it from a bit of a different angle.
Right.
I don't want to pontificate, but as a behavioral health provider, I feel we are in a bit of a crisis with social media, with the way that boys and young men have things at their disposal, such as the internet and the pornography that's available on the internet. It has definitely skewed how they view relationships, intimacy, closeness, love. There is a deterioration that is quite concerning. And this will be a very small attempt at moving that needle and helping those young people understand things in a little different manner.
So I know you described this as targeting the people who would use these services, or women or boys. But how would you find them? You're going to find them through schools? Are you going to find them through the law enforcement? How are you going to identify?
The way Julianne initially explained it to me, because again, it's $30,000.
Right.
The impact of it, the resonance of it is very limited. So it would likely be an adjunct, an additional component to the work that they're already doing in the schools, in the classroom.
Okay.
To plant the seed at an early age,
Okay.
and help, that young person.
Try to teach somebody what's normal, the normal.
What's that?
Try to teach like what the normal.
Yes.
is, yeah.
Yes, less prone to objectifying a female, let's just say, or sexualizing them. Again, it's a very big challenge, because whether it's, as I referred to, pornography on the internet versus the music videos, or just, if you look at reality television now, it's mainstream television is so different than it was just a decade ago in terms of what's tolerated, in terms of dress and clothing and acts and behaviors and such.
There's a big issue for schools now that are having to decide whether or not to suspend kids or put them on probation or whatever for publishing videos that taken through bathroom holes in the bathroom wall or the gym locker room wall or
Which has led to suicide.
Yes, so I think it's a great start. I'd make the motion if you don't have one.
Second,
I'll second.
further discussion?
Aye.
All in favor? Aye.
Aye.
Opposed? Carried.
Thank you for your support on all those resolutions. I do have a few agenda items that I'd like to talk to you about. At this point, I'd like to invite Danielle Hotel up to the floor, to the table, I guess. I just wanted, before I ask Danielle to speak, I want to give a little update. You may remember last month I had several agenda items, so I'll offer you some updates on that. One of them had to do with my request to create a sign at 325 Columbia Street that would represent the tenants. So I did survey, the request was to survey the tenants. I have unanimous interest in there being a sign, both that automotive traffic could see and also maybe pedestrian traffic on the building. So we're looking at 2 signs. I've spoken with the sign maker. We've exchanged ideas. He's not ready to offer me a rendering, but we will be for March. So to be continued there. In terms of the emotional support animal, I was worried about running out of time today because I knew I had a hefty agenda and I didn't know what the other department heads had. So I
This
asked,
seems like the best meeting.
I asked that individual, that staff person from my department to hold off. She'll likely join me in March, as will the county attorney, to discuss that topic with all of you. So then that leads me to opioid settlement dollars and how we recommend or are offering to distribute them. Things are well underway with Oxford House. Greene County is composing their contract. We are working on a draft as well. We're trying to make the 2 contracts as synonymous as we possibly can, just to make things more, sensible and such. The work group that meets every 2 weeks has been, and Danielle is a part of that work group. And for those of you that don't know Danielle Hoteling, she is the executive director, of Reentry Columbia, who works with formerly incarcerated individuals, whether returning to our community from prison or jail. We've been talking about how these dollars might be helpful and useful in expanding the Reentry Columbia, and I'll let Danielle take it from there.
Okay, so thank you, everybody. So as Director Amasi mentioned, I'm the Executive Director of Reentry Columbia. Many of you probably know me from my former work in opioids with Twin County Recovery Services. And what we do at Reentry is very much like what was said, is folks that are reintegrating either from jail or from prison, but also anybody that's justice impacted, right? So we work with the Sheriff's Office, we work closely with both offices on the MDT team and drug treatment court and things like that, just in terms of giving people the best opportunity for success, reducing recidivism, increasing public safety for those that are already involved in the criminal justice system. So upon having these discussions around opioid settlement money, what I've seen sort of from my previous lens and this one is the intersectionality between substance use disorder and the criminal activity and pending charges that we have in participants in our program. So what we do is provide case management and supportive services to help people. It could be educational supports or vocational supports to get back into the workforce. It could be employment searches. And what we're finding is that we don't have enough manpower. It's myself and one other person that's doing that work. And we would love to do more of that work in the community because there's definitely a need for that. We go into the county jail and we have a great relationship with Sheriff Kraft and his staff there, and provide case management services so that when folks get out, they have the best opportunity for success and hopefully they don't have to enter back into the criminal justice system. So just to give you guys a little bit of a scope, for 2023, we had a total of 132 cases, folks that were served by Reentry Columbia. 59 of them were new intakes for the community. So those might be people that are just coming back. So probation, parole. It could certainly be people that are just involved in the criminal justice system. And then 31 of those were in Columbia County Jail. And as I'm talking to Sheriff Kraft, he would love to see more of us because there's more and more of a need being demonstrated for his personnel. And when we're in there, we can sort of provide those the case management and, steer people in the direction of other referral services, the outcomes are certainly better. And we held 181 people were touched by the community groups that we've had. We do a warm night weekly, which is just a safe space for folks who are just as impacted to come. So sometimes it's talking about the stigma associated with coming back to the community, but also we have presenters come in, so they talk to them about financial literacy, for example, because again, if you've been living a certain type of way, you may not be as familiar with how to budget, right? Or how to access resources so that you don't have to fall back into some of those more criminal lifestyle. So we were just looking to expand our program to employ another case manager to help that effort. So I think, is there anything else I should add?
You know, we're certainly open to questions at this point. This is something that the work group unanimously supported, but, as you all requested, you requested the recommendations to be brought to you, such as I did with the Oxford House, a housing model, and that's why I've asked Danielle to come and talk. It's understood that there's no guarantees. If you're interested in talking privately or would like to talk with me privately about this, I'm happy to do so. But if you have questions for Danielle as to how these dollars could be impacted, the cost of the one FTE annually comes in at about 70,000.
Yeah, 79,750, but that is the salary, supervision, fringe benefits, additional supports, a phone, basically, phone, computer for that personnel, additional training.
Are we being asked to make a commitment for 1 year or a multi-year commitment?
This would be multi-year.
And this one agent would be, you said 131 is how many dealt with in the previous?
So there was 132 total cases. That's just for 2023, but the additional impacts certainly.
If it helps the committee, my agency and through my budget, we see reentry. We've been doing it for a number of years now. And we've seen a great benefit because prior to reentry, it was caseworkers that were trying to do this work from DSS and from, care coordinators. It's very difficult if you're not structured to simply work with this population head on. So, I've had this in the DSS budget now, I think for 7 years, or it's going on 7. We looked at it every year to see its efficacy. And every year we've pushed the budget up, save for the time that the pandemic came around, because it's money well spent. If it's not spent administratively and it's not spent on people who are helping individuals one-on-one, then you spend, I found, much more money on the other end of all of this. So, I offer that it's become a permanent part of the DSS budget. And that was after several years of looking closely at this. So I can attest to its efficacy. I think that the fact that it's as good as it is, and yet we could serve more if there were more capacity, speaks to the need to do that.
So do we have a sense of what the overall need is? I mean, we're talking about one cohort now, incarcerated individuals. What about how many other individuals need to be served for these kinds of services?
Well, and I think that's why we try to use, when you think ranch or you're thinking jail, prison, right? But we like to use the term justice impacted, because there are folks that maybe it's they're in behavioral health court or they're in drug treatment court. So we're hoping that we can catch them and divert them away from the criminal justice system. So I think in terms of, I could certainly create mechanisms within reentry to report that on the back end of how we can expand that. But I think we just help anybody that's justice impacted. And again, to the commissioner's point, a lot of what we do is the job search, is trying to find housing so that they're not, in DSS housing, that they're not landing on Director Almasi's door in crisis. We're trying to sort of divert people away from those mechanisms. And really, because we're not care coordination service, we don't have all these boxes we have to check, right? We can really meet the person where they're at, have a discussion, come up with goals, and really help them to propel forward in a way that other agencies that are prohibited by the state and other infrastructure may not be able to do. So
Supervisor Adams, if you only look at our population, you only see really the tip of the iceberg. I think they.
That's what I'm concerned.
And
Yeah.
it's just the tip, where we had far less trouble as an agency serving the incarcerated in Humboldt County, simply because we have people in the jail that are embedded, they're close by. We never know what's coming at us from a release from state prison, because often we don't know that until just before release. But a lot of people call Humboldt County home. And so, that's what I laud the efforts of the H&HS.
Did they let you know ahead of time that somebody from prison's coming into the?
In an ideal world, they would. And there are times that we do know and we can write and correspond with people before they come back, but not always.
But that's a nice way of saying no.
I have to respect,
Yeah.
Director Almasi, who we tasked with coming up with suggestions, and if this is your suggestion, I would support it.
Yeah, same here.
I agree.
Yeah, and along with the Oxford House, you had 4 driving parameters from the listening groups, right?
Yes.
It was for the acute response, the responses for acute issues. It was for, the pathways,
Yeah, that-
recovery providers, and where else were those other parameters? Forgive me, I'm drawing a blank.
One of the, this was a bit of an audible. This wasn't part of it, but this certainly will make a significant impact. The one that we haven't touched on yet, which is the most elusive, is creating a clearinghouse, standardizing an entity that will act as a clearinghouse, a resource center, so that an individual who's in crisis or in need, whatever that may be, and we haven't sussed out what the boundaries of that are going to be, they can reach out and get answers, or at least be directed to an entity that can give them specific answers and information. That's what we're going to be sinking our teeth into this next round. We feel Oxford House is well on its way. This is something that came up spontaneously in conversation, and it made a lot of sense to the group. Because, if you're able to successfully divert a formerly incarcerated individual or a justice impacted individual away from those behaviors that led them to get on the radar in the first place, you have saved exponentially by doing that. So this is an investment in, that individual's future. I think reentry is tasked in a really unique way as well to work with justice impacted individuals. It's similar to the value of the peer in the clinic. That person with that lived experience can speak to that individual. They have the knowledge and understanding of an environment like a court or a jail or a prison. If you've never been in such an environment, you can't really speak eloquently about it. Whether it's through firsthand experience or just working in that environment as a professional.
Well, I concur with Supervisor Knott and supporting you on this for sure.
Yeah, same here.
So what are you looking for, a motion, or are we doing a resolution?
Well, I was gonna ask that question. What do you want to come out of this meeting with?
Well, if you're inclined to offer me your support for using a portion of the, we have 500,000 in hand, give or take. I think the total amount, would be, correct me if I'm wrong, is it 1.2 million or something like that? I'm looking for a commitment to this, expense,
At 70,000 a year,
80,000.
80,000. All right, because this has 70 on that.
Yeah, that's my mistake.
So like a motion here
But
to,
you're also.
for him to do a
looking for
resolution, a contract
multi-year-
with,
I'll make that motion.
Yes.
But we're also looking for an open-ended multi-year commitment. So
Yes.
we're talking about numbers, but we're not putting a cap on this number.
Agreed. And I'll bring this up. I was somewhat reluctant, and I'm still reluctant to say this because the director and I have only had one conversation about this. There is a way that we could potentially offset this expense. It's in the very, very early stages, and I wouldn't want to commit to that at this moment. But there could be a way to get reimbursement for some of the work that this individual is doing, but that's a much, much larger conversation to lower the draw that we would be making on the opioid settlement funds as a whole. We just had one conversation. I've spoken with somebody in my department about it. It has potential, but it's much too early to elaborate or consider it as a done deal. So right now, the ask really is for the entire expense annually of 80,000. With the chance of maybe offsetting that.
I see this as a ounce of prevention is worth a pound of cure
Yeah.
type thing. So I think that the $80,000 for a position that could potentially save however many lives or reduce the expenses on, like you said, on the back end on the incarceration. So I second the motion.
A motion and a second, further discussion?
Just if you can have the resolution to finance for the Kelly, so it can go to
For next
finance.
week, yeah.
Thank you.
Yes.
Thank you guys. We really appreciate it. All in favor?
Aye.
Opposed?
No,
Carried.
I give a no. And I do respect the proposal and your organization. I just don't feel I have the inclination to really fully understand the efficacy of the program. And I fully subscribe to your idea of an ounce of prevention. But I don't think we've had enough information today. So I haven't had enough information. So 1 minute.
Thank you, Supervisor Adams. All right, are there any further questions for Director Almasi? Magnificent.
Thank you, everybody.
Thank you.
Before I go to questions from the public, Director Grandinetti, can I put you on the spot for a minute? Just because I missed the meeting, you met recently about Think Differently and looking forward to your new year. Do you want to comment on that briefly? And maybe we'll have a report coming up.
Well, I also have Supervisor Adams here, Commissioner Gibson here, Supervisor Cousin on the phone that could answer as well.
Hey, perfect.
No,
But
actually,
you're the man.
actually, we had a very good meeting. I wish I had details still that, but one of the main things we were gonna do is put a budget together with Lisa Galena. So we set up a meeting next Tuesday in the commissioner's office. And our goal is to kind of, again, start small and kind of grow. And I think Lisa's now put something together that could show that growth is important here. And it's given us, I think, enough data to move forward with more expense. The other thing is we're looking at, Commissioner, you and Jen are going to look at what number, the homeschooling numbers. See how many folks. So we're trying to figure out, and I think Supervisor Adams was trying to figure out in what context help fix this problem. So we're going to start trying to look at numbers, not just the 6 school districts, but also homeschool. And Claire had an idea as well that we were going to move forward. Colony has a kind of we're going to look at their prototype to see what they're doing to kind of make sure that we're not duplicating or trying to reinvent the wheel per se. So that's where we are.
Oh, I'm sorry. Yeah, just to expand on that, what came up is a question as to the level of training that the school district provides for teachers. And then the question that naturally followed from there is, okay, then what are the curriculum requirements of homeschooling and how does it take this into account? I do not know the answers to those things. And so that's why we want to get into it a little bit. And we'll bring that back to the next meeting.
And then the other part was to try to insulate the safe space building that we're using out for the Chatham Fair. So Lisa's going to do kind of a walkthrough. The commissioner was going to talk about figuring out how we can kind of prevent as much noise as we can. I think there's like a tree that hangs over top of the building that something falls out of the tree and it keeps going ding, ding, the whole time. So we're looking to kind of, that I think we had over 200 kids participate in that safe space room for the Chatham Fair.
I was one of them. I went and hung out.
So we're going to look to kind of do more publicity and going forward for the Chatham Fair. But again, we're meeting next week.
Yeah, it was a great space for the Chatham Fair, and there was an area where you could see all that cold air was disappearing and things like that. But it was a beautiful space. When I was there, multiple families came in and utilized it. So,
anything to add?
No.
Thank you, and I apologize for putting you on the spot, but I just can't afford being done early, right? I got to stretch it out. All right. If there's nothing else from the supervisors on the committee or anyone else, I will ask for comments from the public. There being none, I'd ask for a motion to adjourn.
So move.
Second.
Further discussion? All in favor?
Aye.
Opposed? Thank you, everyone.
Thank you.
Thank you.
All right, I'd like to call this, public safety meeting to order for, Thursday, February 20th. It is 5 PM. First up, we have public safety, Director Zoni. Public defender Zoni.
Good afternoon, everyone.
How are you, sir?
I have, two general resolution requests this evening. First is to authorize the chairman of the board of supervisors to consent to a one-year extension of the third. Thank you.
Okay. Have a motion and a second. All in favor? Opposed? Further discussion? Carried.
And then the second and final resolution is to accept grant award. Thank you.
Second.
Have a motion and a second. All in favor?
You heard the word
Opposed?
Ray's good at accepting.
I pulled the Ray in the last meeting. I said, Grant, move it.
I'm just getting good at this.
Yeah. So, further discussion? Any other questions for Tony? No, you're fine. You're all set. Thank you, sir. Okay, next up we have the sheriff. Under sheriff, how are you?
I'm well, thanks. How are you?
I'm doing well, thank you. Put these back together for you.
You know, just keep going.
Just keep piling. All right.
Yes.
Whatever you want to do, you're the boss.
Yes.
How are you this evening?
I am well, thanks. How are you?
Doing well. What can we do for you?
The first resolution I have is for authorization to fill a full-time corrections officer
Move it.
position.
Second.
Have a motion and a second. All in favor? Opposed? Further discussion? Carried.
The second is for authorization to fill a full-time deputy sheriff's position.
Move it. Second. Have a motion and a second. Further discussion? All in favor? Opposed? Carried.
All right, and completing the circle is up for authorization to fill a full-time communications officer position.
Move it. The motion, second?
Second.
Motion and a second, all in favor? Opposed? Further discussion? Carried.
Last but not least is for the sheriff's office to enter into agreements for enhanced enforcement patrols.
I love it.
Second. Motion and a second, all in favor? Opposed? Any further discussion? Carried.
Let me go with population stuff.
Sure.
For our out of county inmate report, we housed incarcerated individuals from Dutchess, Franklin, and Greene County for a total of $11,220. And from the previous year, the difference is $25,470.
Thank you very much. Any other questions for the undersheriff?
I do, Chairman. Were those position fills with pre-bargaining salary?
Good question.
That's a good question.
I think
So-
they were pre-bargaining salaries.
Those might be pre-bargaining salaries, but all three positions were vacated after we completed the negotiations, but before the inception of that.
Wait, it's not retroactive.
No.
Okay, that's not fair. Thank you very much.
You're welcome.
And a couple of things, but, yes. 911, how are you, sir?
Not bad. Good evening, everyone. I have a resolution request authorization, accept the FY 21 as.
Move it. Second. Have a motion and a second. All in favor? Opposed? Further discussion? Carried. Thank you.
I have another resolution
Move it.
request.
Second. Motion and a second. All in favor? I can't even keep up with the paperwork here. You guys have been so long. So opposed? Further discussion? Carried.
I have a resolution request to extend the budgets for the following grants that are listed there from, basically, we're extending the budget into 24, and those are 911 grants currently.
Move it. Motion?
Second.
Second. All in favor? Opposed? Further discussion? Carried. Thank you.
Next resolution for the same, for emergency management grants, to extend the budgets into 2024.
Move it. Second. Motion and second. All in favor? Opposed? Further discussion? Carried.
I submitted our annual report for 2023 for the 911 department for your review. And the only other thing I have is agency data for January of 2024. We just got 1,295 EMS agencies, 424 fire agencies, 1,714 police polls, and 433 public service calls. There's a typo in my agenda it says 2022 for 392 calls as a comparison. It should be 23. I apologize. That's all I have.
Anyone have any further questions? Thank you, sir.
Thank you.
Next up, Mr. District Attorney. How are you this evening, sir?
Good, how about yourself?
I'm doing well, thank you.
Good afternoon. So we have three personnel resolution requests. The first is for a vacant court liaison position.
Move it.
Got a motion? Second? All in favor?
Aye.
Opposed? Further discussion? Carried, thank you.
The second is for the chief investigator position, which is currently vacant. And as an aside, Mr. Hogenkamp is retiring and
Move it.
I'm very grateful to him for what he's done and the time that he's stayed on for me.
Thank you.
Second.
Got a motion and a second, all in favor?
Aye.
Opposed? Further discussion? Carried.
And then we have a request to fill a vacant district attorney position as well.
Move it.
Move it.
Almost.
Oh, that was district.
Okay. I got it.
Sorry, I had to get in on one of those motions.
That's all right. We'll put you down. Kelly put you down on something.
I should have said assistant district attorney position. As far as I know, district attorney is not vacant.
I was gonna say, I thought
At this moment.
that position was filled. So,
And the only other thing I have is I wanted to
I need to finish. I'm sorry.
Go ahead.
We have a motion and a second. All in favor?
Aye.
Opposed? Is further discussion? Carried.
Okay.
Thank you, sir.
So yeah, the only other thing I have is I have been in discussions with a vendor that goes by the title Advent FS to help relieve some of the strain we have in my office with our traffic ticketing system. It's a huge burden on my staff, and this is a system that would actually be free to us because they take a $5 service fee. This allows people to resolve their tickets online. Everybody would still have the same rights that they have now, which is if you want to plead not guilty, you certainly have the right to do that. But if you want a resolution right now, it's crushing my office. And so we'd like to outsource that if possible. And there's a vendor that wants to do it. So we're looking into that.
Okay.
Again, is MIS involved?
We haven't been involved with them yet. We certainly will be involved. And of course, confidentiality is one of the biggest concerns. This is a vendor that a bunch of other jurisdictions in New York State have used. I talked to Jefferson County's district attorney, but they're also Orange County, Rockland, Suffolk, I think are using them as well. They do a whole range of stuff. I would look to them to the limited purpose of these traffic ticket reductions so that our front office staff can focus on opening cases and the real work that we need them to do.
Makes sense. Thank you.
No, I think it's actually like normal human intelligence. Yeah, no, I mean, the way it works is because they take a service fee for the reductions, then it's no cost to us. And the individuals get a benefit out of it, but we don't have to put the staff hours into it.
So there's no plea, basically, they just pay the fine?
Well, no, so that would be a different kind of system. There's something called a diversion system, which we're not looking to implement right now. This is a simple reduction. You say, look, I'm looking for a deal here. I'm looking for a reduction. Same as if you went and bargained with an assistant district attorney in court, but they can also plead not guilty and go to court and fight the ticket. The judge also, in all cases, if you offer a plea, the judge always has the right to say, no, I don't accept this plea.
So is Advent NFS, is it pre-programmed to accept certain pleas, or is there like a human being that's like...
So they wouldn't take away our discretionary power. We could not outsource that legally to another entity. They do the processing essentially. We set guidelines. Then there's a system in which, it's like a case management system. There's a system in which the attorney who's authorized to accept or deny the offers, then goes through and can say, yes, this meets our guidelines, this meets our guidelines, this meets our guidelines, and then the police can go out to those people. So it goes from hours and hours a day to a few minutes a day for the reviewing attorney.
So they review it, pass it by your office for final approval.
And they, there are certain things that we ask for in each case, or in certain cases, let's say that they had to complete some sort of driver training, they actually track that in their system. So that unlike now, we don't have to kind of chase and wonder whether we have it. We'd be able to look before we go to court and say, look, we can tell they completed the training already at some point.
Very good.
What about access to past records? What if somebody's a chronic offender?
Yeah, so they have to do the same thing they do now. Right now, we have an online system that has been difficult for some people to navigate. And so what they have to do now is they have to call our office and we have to walk them through it. Advent has their own support staff for this who will walk them through it. But yes, I mean, everybody still has to go get their abstracts because we can't offer anybody anything unless we know what their driving history is.
Who sets the guidelines?
We do.
You do.
Yep. Yep. So it would be based on, we already have guidelines essentially for our ticket reductions so that we're fair and we do it in the same way. And we would essentially be giving those guidelines to Advent FS so they can sort cases for us. And then it would still be up to us to review on an individual basis.
It's a bulky program.
What's that?
It's a bulky program the way it is now.
Yes.
Being on the court end of it, it's, yeah.
Yeah. So we're looking to streamline it and take some of the burden off of everybody.
Yeah. Sounds good. Thank you very much.
That's all I got.
Anybody have anything further? Thanks, sir.
Thank you.
Next up, we have fire. I don't see Mr. Keeler here. He has one resolution to appoint Greg Kerner Fox and Maria Ostrander as per diem fire instructors for the fire coordinator's office. I got a motion.
Second.
And a second. All in favor?
All in favor.
Opposed? No discussion, because I don't know what I'm just. You have to ask George.
I can explain that a little bit.
Can you? You want to talk about it?
Okay. Those two people are actually my deputy coordinators for EMS. All right. We're looking to start a physical program at the training center where Dr. Stippa, who's our county medical director, will be offering these physicals to fire companies, but he's going to need assistance, and that's what this is all about.
Very good.
So there's no cost to the county, but is there a cost to the fire company?
Oh, well, with this, there probably will not be a cost to the fire company.
That'll save
Whereas
the fire company's money.
Right now, there's a difference between $65 and $165, so it'll be $100 per person. So we're looking to try to eliminate that.
You might as well come on up, Mr. Keeler, because you're next. EMS, how are you, sir? Thank you for the explanation very much. Appreciate it.
Talking behind everybody's back, that's
All
not
right.
so. Okay, the first resolution request would be to renew our 2-year contract with all the rescue squads in the county. We have to do this every 2 years for New York State. This is just a renewal of the existing contract, not a new contract, because it expires April 1st.
Move it. Second. A motion and a second. All in favor?
Aye.
Opposed? Further discussion? Carried. Thank you.
Next one would be to enter into a contract for CCMS and Columbia Memorial Health for the transportation of critical patients from CMH emergency room to other facilities. This has been an ongoing negotiation and discussion with CMH and the rescue squads through the advisory board. Basically, I can't say enough that the hospital has been cooperative and working with us to try to salvage the transport business out of CMHER to the other facilities. Quite frankly, as you know, CMH is part of the Albany Med Health System. Albany Med, Glens Falls, Saratoga have actually entered into contracts with a large commercial ambulance company. And we are actually just trying to keep everything local here and keep the money within our own EMS system. And the hospital has been bent over backwards and trying to work with us. So we're in the process right now of working with this Fitch Consultants, who's been the consultants that we've used to come up with a contract between our county and the hospital. what this will actually encounter will be, if a patient needs to be transferred from the ER here to, say, Albany Med, any patient that, has insurance, we as CCMS through the treasurer's office will be billing for that. And we are going to have a contract with the EMS agencies that we will pay them up to the Medicare allowable rate, because right now they're only collecting maybe 50% or less on that. And the difference that we're working on with the hospital would be, let's say we bill Medicare $700 and they pay $400. The contract that we're working on now, the hospital will pick up the extra $300 and reimburse us. So that's actually a win-win for everybody around. Obviously, it has to be reviewed by our county attorney's office and the hospital's attorneys. So that's the direction we're trying to take it.
Sounds like it'll save considerable amount of money
Yeah,
for the county EMS.
we have about 600 some thousand currently. So
I'll move it. And then
Second. Motion and a second. All in favor?
Aye.
Opposed?
And the second resolution will basically just be a follow-up to that, that will allow us to pay these rescue squads for taking the transports.
Move it. Second. Motion and a second. All in favor? Opposed? Further discussion? Thank you, sir.
Okay.
Do you want that first, PJ, or the other? Okay.
Fine. Basically, at the last, meeting here for public safety, Michael, Supervisor Paredes had asked for some information relative to, some of the billable calls and the costs involved. Greenport Rescue Squad was very willing to, provide some of this information. And basically, this is their information for 2023. And I think it's important. I mean, you read about this all the time, how reimbursements from insurance companies are not keeping pace with the cost of doing business. And you'll see on there, this is their, for their year, that the cost per claim, the actual cost of moving an ambulance off the ramp is $727, okay? Now, obviously several years ago, it was in the $400 or $500 range. But again, the cost of providing EMS service, the cost of the staff has ramped up. An ambulance is now $180,000. It used to be $90,000. That's just the tip of the iceberg. So anyway, this gives you an idea of how much they lost last year in just insurance reimbursements. Now you ask, how is that made up? Obviously, that's made up through contracts through the towns, as well as the supplement that we have been providing from CCMS for moving around to different locations and taking calls. But there's the true cost. The next one, Kelly, was just because Supervisor Chimides had asked about the city of Hudson. I sent you today.
Yes.
Yeah.
There you go.
Okay, and again, I'm not picking on the city of Hudson. This could be the town of Kinderhook. It could be some other location, but this just gives you an idea of some of the costs involved, whereby I know we discussed previously that, when we projected doing chargebacks by population, that, Hudson has paid $75,000 a year. Well, actually, the agency's losing over $200,000 a year by just servicing the city. And again, I'm not picking on the city. This could have been any other area within the county. But just so you have some idea of the insurance reimbursements, just do not keep pace. And unfortunately, unless we continue to subsidize this EMS system, it won't be good for anybody.
Won't work.
Yeah. So that's just an FYI.
Thank you for that.
I sent you all the information that you have here that Kelly's bringing up now. I'm not going to take time to get into it, but that is all. We had a 2-day workshop with the Fitch and Associates at the hospital, who provided space for us and also participated in the workshop. And we basically laid out almost a 3-year plan in working on different issues, from patient care to training to collaboration, so on and so forth, with goals that are attached to that. We're going to a DMS advisory board every other month. We're actually going to work on this. We're going to work as committees that will involve not just the agencies themselves, but also people within the agencies. Because I think inclusiveness is going to be a key part of this and helping everybody become, aware of what's going on and how do we salvage and move forward EMS in Columbia County. So that's just a snippet. And the other one, Kelly, was the information package that I forwarded on to you. There. So we talked about our EMS system, so to speak, and the questions came in. This was for 2023. How many calls these agencies took within their primary area, and how many calls were handled by another agency, which means when an area is depleted, we're moving another agency into that area. So I'll just click on Greenport there. They answered 5,000 calls in their own area. However, 200 calls were answered by another agency that we had already moved into their area. And the last one, how many times we move these agencies around because of depletion. And you'll see it's 4,400 times over the year. This is just statewide and 911 calls because their area is depleted of service. So it truly is a system. The agencies are committed to work with this as a system because individually, nobody's going to make it on their own. Okay. So this is just informational purposes at this point in time.
EJ, are transports in the total number?
Yes.
Okay, so transports are largely in the Greenport number. So 45% of the calls were outside of areas, 44 roughly.
Yep.
Okay.
So we're moving them like 10, 12 times a day.
Right.
Very good information. Appreciate it very much. Thank you. Anybody have any questions?
I just wanted to express my appreciation for sort of like you thinking about this big picture and providing all the detail. I know that like as we need to make some big changes, that's why I'm interested in sort of getting into the details so I can understand it. So
this will be a work in progress, and I appreciate your questions because without that, I wouldn't have the information to present to anybody else. So thank you.
Yes, you would. You would have the information, but yeah, it wouldn't be in public forum, right?
Right.
Thank you, PJ. Okay. Next up, we have public safety.
No.
Emergency management. Yeah, read the wrong line. Director Harrison.
Thank you, sir. Our report. And also I mentioned HPD line of service death. That type of detail and putting it together is a tremendous undertaking. And I'd like to thank 911 and the state police, Hudson Police, and Sheriff's Office for everything they did during that. The state police stepped up and offered to plan the logistics of it to help HPD out. And they brought everybody together for a planning meeting. And that's similar to a citywide parade, but for parade, you have weeks or months to plan for it. This, you only have a few days. You have to shut roads down with literal notice. The hospital has to be involved. We have to reroute ambulances and everything. There's a command post set up. There has to be special radio frequencies that have to be provided, which 911 did. And, everybody really came together in a short period to do that. And also, there are three of us attended the New York State Emergency Management Association conference in Syracuse this past week, or last week. And one of the main issues that they talked about was providing EMS coverage for the counties. It's a serious problem statewide. And what PJ does as our EMS coordinator is being watched by other counties. And, he does a tremendous job to make sure that our whole county is covered. And it comes from experience. You can tell he knows what he's talking about. But this is a statewide issue. It's serious. And, I think we're ahead of the game here, but.
Director Harrison. Thank you, sir.
Thanks.
And we have South DWI.
John's not here. He just needs to,
Okay.
Roll funds.
Roll funds over, so there's a resolution, move it.
Second.
Have a motion and a second, all in favor?
Aye.
Opposed? Carried. I can't sign everything, Kelly. You got
No,
you got
it's
dope
all
me,
right.
man. I'll tell you, man. I think I'm doing a mortgage here. With that, are there any questions from the public? Any other comments for supervisors? With that, I'll
Motion
entertain. Motion adjourned.
Second?
Have a motion and a second, all in favor?
Aye.
Carried. Thank you very much.